Why are antivenoms not easily accessible in India? The article explains why antivenoms, which are life-saving treatments for snake bites, are not easily accessible in India, even though the country has a high number of snakebite deaths and injuries. Snakebite problem in India. 1. High number of snakebite deaths. Between 2001 and 2014, there were 1.2 million snakebite deaths in India. Rural areas, especially during the monsoon season, are most affected because snakes are more active and encounters with humans increase. Many victims are agricultural workers who cannot access medical care quickly. 2. Why is it a crisis? Snake bites are preventable, but delays in treatment often make them fatal. Lack of awareness and inadequate medical facilities add to the problem. What are antivenoms? 1. How they work. Antivenoms are made by injecting small amounts of snake venom into animals like horses. These animals produce antibodies that are later used to create antivenoms. When someone is bitten, antivenoms neutralize the venom and allow the body to recover. Snake bites in India, a serious public health issue. Scale of the problem. A landmark 2020 study showed that India accounts for the highest number of snakebite deaths in the world, with 58,000 deaths annually. Over 12 million people suffer snakebites in India, leading to deaths or permanent disabilities. Impact on rural communities. The worst affected are agricultural workers and villagers, especially during the monsoon season when snakes become more active due to floods and poor garbage management. Many people delay seeking medical care because of the long distance to hospitals, lack of awareness, or reliance on traditional treatments. What makes snake venom deadly? 1. Composition of venom. Venom is a toxic cocktail of proteins that paralyzes, kills cells, or disrupts blood flow. Once injected, venom causes damage like cell destruction, internal bleeding, and paralysis. 2. Effects of venom without treatment. Victims may suffer from organ failure, paralysis, and death if medical help isn't received in time. Cytotoxins in venom cause severe pain, swelling, and tissue damage at the bite site. What are antivenoms and how do they work? 1. Production of antivenoms. Antivenoms are created by injecting venom into animals, usually horses or sheep, in small amounts. These animals develop antibodies, which are extracted and processed to make antivenoms. 2. How they neutralize venom. Antivenoms bind to venom toxins, neutralizing their effects and helping the body clear them out. However, for antivenoms to work well, doctors need to know which snake species bit the victim and how much venom was injected. 3. Polyvalent antivenoms. India mainly uses polyvalent antivenoms that target venom from multiple snake species like cobras, kraits, Russell's vipers, and saw-scaled vipers. These are not always effective against venom from less common snakes, making treatment unreliable in some cases. Challenges in accessing antivenoms. 1. Logistical issues. Antivenoms need proper cold storage to remain effective. Rural areas often lack refrigeration facilities, leading to spoiled or degraded antivenoms. Transporting antivenoms to remote areas is difficult due to poor roads and lack of resources. 2. Healthcare gaps. Many rural hospitals and clinics are not equipped with antivenoms or trained personnel to administer them. Victims sometimes reach hospitals too late due to long travel distances or lack of awareness. 3. Cultural barriers. Superstitions and traditional beliefs about treating snakebites often delay proper medical intervention. 4. Cost and inefficiency. Manufacturing antivenoms is expensive, and limited resources mean that demand often exceeds supply. Poor healthcare infrastructure results in inefficient distribution, making antivenoms inaccessible in high-risk regions. Efforts to improve antivenoms. 1. Current research. Scientists are working on creating synthetic antivenoms using advanced techniques like recombinant DNA technology. These are safer, cheaper, and easier to produce. AI artificial intelligence is being used to map venom compositions and design specific, highly effective antivenoms. 2. Tailored antivenoms. Researchers in India are studying the venom of local snake species to develop antivenoms that target specific toxins. This can ensure better regional coverage, especially for bites from rare snakes. 3. Diagnostic tools. New diagnostic kits are being developed to quickly identify the snake species involved in a bite. This helps doctors choose the right treatment. Snakebite statistics in India. 1. India is big for snakes. Most snakebite deaths are caused by Indian cobra, common krait, Russell's viper, saw-scale viper. 2. Other dangerous snakes. Less common, but highly venomous snakes like king cobras, hump-nosed pit vipers, and sea snakes also contribute to bites, especially in specific regions. 3. Regional variations. Snake species and venom composition vary across India, making it hard to create a one-size-fits-all antivenom. Future directions. 1. Better healthcare access. Strengthening healthcare infrastructure in rural areas is critical to reducing snakebite deaths. Increasing the number of trained medical professionals and hospitals equipped with antivenoms is essential. 2. Public awareness campaigns. Educating people about snakebite prevention, first aid, and the importance of seeking medical care can save lives. Simple precautions like wearing boots while farming and keeping homes snake-free can reduce risks. 3. Focus on research and innovation. Collaboration between scientists, government, and healthcare providers is needed to ensure cost-effective, region-specific antivenoms. Investments in venom research and production facilities can boost India's capacity to tackle this crisis. Key takeaways. India has the highest number of snakebite deaths, and rural communities are the most affected. Antivenoms are the main treatment but are often hard to access due to logistical, medical, and cultural challenges. Advanced research is leading to better diagnostic tools, synthetic antivenoms, and tailored treatments to reduce deaths and disabilities. Strengthening healthcare infrastructure and increasing public awareness are essential to tackling this preventable crisis.